Okay, I hope you can hear me. On behalf of the Counseling and Psychological Services Center, I'd like to welcome you all to this webinar. Um, this webinar will be talking about depression, the black dog, and let's just go ahead with this. So what we tend to cover in this webinar, because we're a bit short on time, we'll try to make up for the time. We're going to actually cover what depression actually is, its subtypes, the signs and symptoms of depression, common treatment protocols, and how to get through or help someone going through depression. So before we go ahead, I would like to ask you guys to just take a minute and just write maybe in the chat box what you think depression is, just so we can get a sense of what you guys understand by it. Right. So we have one answer, it says chemical imbalance. Another one says perpetual cycle of negative thinking, disruption of mental health. Okay. Okay. Point of, okay, where one starts to question one's self-worth. Absolutely. 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 Losing expectations, grief, mental functioning, pessimism, hopelessness. Absolutely. Absolutely. So I guess all of you have somewhat of an idea what depression actually is. And all of these statements that you've entered and you've written, these are more or less the symptoms that we will be covering. So before we go any further, I'd like to show you this short video, which will just explain a bit of what we're going to get into. So just let me stop this. Right, so as we saw in the video that this depression, the black dog, many names to go with, has a lot of debilitating symptoms that can greatly impair your life. And if we just go ahead, talk about what depression actually is, we say that all of us, or most of us, go through phases in our life when we are actually feeling low, and of course facing life's challenges, when we have feelings of sadness. But when we talk about depression, specifically clinical depression, it includes feelings of helplessness, hopelessness, worthlessness, as you all stated. And definitely there's a biological perspective as well. And of course, when there is a increase frequency, duration, and intensity, and we talk about these three things being exacerbated, so definitely that could lead, or that could point towards an individual having clinical depression. So fun fact, the term black dog that we have come to use for depression was actually coined by Winston Churchill, who actually, when he would feel in a state of melancholy, he would actually start calling this phase black dog, and hence from there, this term started to develop. So key facts about depression are that basically globally more than 264 million people, and these are people of all ages, even children and adults and elders, they actually suffer from depression. It's one of the leading causes of disability worldwide, and it's more targeted towards the female sex for some odd reason. Scientists have not been able to identify as to why as yet. Depression can definitely lead to suicide and has a high mortality rate, but it's to know that there are effective psychological and pharmacological treatments available for depression. So that being said, let's talk about the causes and symptoms of depression, right? So as some of you noted in the start that it's due to some chemical imbalance, then definitely yes. depression, there are many theories of why, as to why depression could come on, why the onset could start. uh, some of them posit that basically it could be some anatomical abnormalities in the brain. It could be due to some chemical imbalances. It could be due to some hormone deficiencies, or maybe some imbalances in your body. And definitely, there's a high correlation, as research posits, that genetics does have a high role, a great role to play in depression. If your relatives, and we're talking about close relatives, parents or grandparents, have depression, this might run in as well. Again, there's no set pattern as to why these things happen, and which one contributes more, but of course, all these do interplay and have a significant role. So, again, there's a lot of things that we have to talk about. And then when we talk about the symptoms, so most of you noted that the definitely one thing we call depression as a mood disorder. So depression will actually affect your mood. You might feel a lack of energy almost every day, feelings of worthlessness and guilt. You might feel hopeless and pessimistic. And of course, it can also have cognitive deficits. It can impair your focus, your memory, and it can impair your cognitive abilities to a very great degree. So, of course, it affects your sleep as well. And depending on the type of depression, you might sleep too much or sleep too little. There's a loss of interest or pleasure in things that you used to do or used to enjoy. There's preoccupation with thoughts of suicide, death. You might feel restless or slow down. And then again, depending on the type of depression, you might gain weight or lose weight significantly, because this affects or impacts an individual's appetite greatly. And feelings of agitation, restlessness. You might feel cranky, lose pleasure in life. Again, overeating directly impacting the digestive system. Aches, pains, these somatic concerns might also be there. Muscular pains, joint pains, and then it might also be accompanied by feelings of anxiousness or feeling empty. So, right. So, types of depression include unipolar major depression. This is one type of depression. There's persistent depression, which lasts for a significant period. There's disruptive mood regulation, which is typically found in children and adolescents up to the age of 18. There's premenstrual dysphoric disorder, typically found in women during or near their menstruation cycles. And all of these have different symptoms and signs and symptoms. Basically, the main thing we need to be concerned about these labels, and the only purpose of these labels is to identify the main treatment. Because if we get the right label, we can treat these different types of depressions with a greater efficacy. All of them do share common symptoms and common signs, but it's one thing to realize that in unipolar, or what we call MDD, major depressive disorder, there's normally a 2 week period where an individual might feel a bout of depression. And then persistent depression, as it says here, lasts 2 years, 1 year in adults. And then there's different time slots for different types of disorders. So there's also a type of depression related to substance use. And of course, individuals who consume alcohol or maybe other substances, they might be susceptible to acquiring this. Or then there's also depressive disorder due to other medical conditions. Um, if there's been some sort of, okay, I can hear myself. Someone just, can I please request you all to mute your microphone? Right, and then there's other type of depressive disorders such as minor depression and other depression that might not classify in a category. So having this said, I'd like to show you a short video to clarify what we've covered. Associated features of depression may include anxious distress, as we talked about. These may be accompanied by feelings of anxiety. There could be mixed features as well. There could be periods of high energy, talking too much, and then um, self self-esteem issues. And of course, there are atypical features where you may feel hungrier, and you may need to sleep less or sleep a lot. And of course, these people are sensitive to more rejection. There may be psychotic features as well, especially individuals who are going through grief, intense grief. They might see things or experience things that might not actually be there. So, um, other associated features may include catatonia, where you're unable to move your body in a normal position, or there might be psychomotor retardation. You tend to be slower than usual. Of course, there's peripartum or postpartum depression that is normally during the phases of childbirth that women might go through. And of course, a lot of people do suffer from the seasonal patterns where um, normally in winters, the colder the weathers are, individuals tend to experience a lot of low moods. So, um, what can be done for these things? I mean, we've talked about all these symptoms, and we've talked about all these scary things. What can we actually do about it? So let's just watch the second half of the video,